It's really fascinating when you look at the blood, coming out of an individual from the one arm. It's just look this kind of dark, nasty blood, and then it gets filtered and ozonated, in the machine, and then it goes into your other arm, and here it's just vibrant and red and oxygenated, and it just looks beautiful. Did on one individual, we did nutrition, live blood cell analysis while the individual was receiving EBOO. So we took a little drop from their finger and put on the microscope, blow it up on a big screen, and then we can look at the red blood cells, white blood cells, and how they're all behaving. And you can also see pathogens. You can see fungus and spirochetes and things like that.
Hi, and welcome to the Lyme Bites podcast, where we shine a light on the misunderstood science of Lyme and other vector-borne diseases, as well as the truths that many still miss. I'm Dr. Mariah Hinchy, naturopathic physician and fellow of the Medical Academy of Pediatric Special Needs. I specialize in treating chronic Lyme disease as well as other complex inflammatory conditions. In this podcast, we break down what's working and what's not. We share the facts that most people miss, we challenge outdated thinking, and we give both patients and practitioners the tools to heal smarter. So let's get into it and change the way we heal Lyme. Hi, and welcome to another episode. I'm your host, Dr. Mariah Hinchy, and I'm so excited to introduce to you tonight's guest expert. Here with me is Dr. Michael Karlfeldt, who is a fellow board-certified naturopathic doctor. He's devoted his career to practicing and promoting natural health. He is a high-demand speaker, author, and educator in this field. Dr. Karlfeldt provides personalized naturopathic care at his busy multidiscipline integrative medicine center, the Karlfeldt Center in Boise, Idaho. He treats the root causes of diseases and strengthens the body's ability to heal. Dr. Karlfeldt has practiced medicine for over 30 years and is one of the leading experts in treating cancer and increasing awareness about natural ways to treat cancer. Additionally, Dr. Karlfeldt is the host of the internationally recognized podcasts Integrative Cancer Solutions with Dr. Karlfeldt and Integrative Lyme Solutions with Dr. Karlfeldt. Here, he features people who have successfully conquered both of these diseases. Finally, he's the author of the #1 best-selling book on Amazon, A Better Way to Treat Cancer. Welcome, Dr. Karlfeldt. Thank you so much for joining us tonight.
I'm so excited. This is going to be so fun and so great. So thank you so much for having me.
Absolutely. Tell our listeners a little bit about how you came to have one of your specialties treating Lyme disease.
Well, so Lyme, when you're in the field for as long as I am, then you come across patients with very complex disorders, and you always try to find, what are the commonalities, how can I get better at addressing this? And when you look at Lyme, it is exactly that. That's why I have both cancer, Lyme, and there's a lot of kind of correlation between the two, and we'll talk a little bit more about that later on. Lyme, as I was seeing patients, you do kind of the normal therapies, and they don't tend to get better, and then you have to start to dig deeper. And it was not until really actually it was Dr. Dieter Klinghardt, that going through all this training that really opened up my eyes, and this would have been back in the 2010 or something like that, or maybe a little bit earlier than that, that I really dug deep into Lyme because patients dealing with chronic pain disorder, neurological brain issues, and you do different, herbs to support that, but then you're realizing there's much more to that. And that's kind of how I stepped into Lyme, just the desire to help people that were really battling.
Yeah, and not really getting help elsewhere, I would imagine.
Exactly. And that's the thing is that is, I mean, and I know you've talked a lot about this already. Lyme patients, they're so frustrated. They go to so many different places, and they don't find a resolution, and it's so frustrating. That's why they deserve that extra time. They deserve that extra look and deeper look to see what the underlying factor is so that we can address it.
Yeah. And I would imagine this is part of what inspired you to develop the Integrative Lyme Solutions program that you use with your patients.
Exactly. And there's so many tools out there, and we pride ourselves in bringing together all these different tools, and we talk a little bit about them, later on, like photodynamic, ozone, mitochondrial, IV support, and neurological, going after lion, go mold, going after. So we have frequency medicine, detox medicine. We do a lot of it here at the center. So patients fly in, and we can hit them a little bit harder with these different therapies, and to clear out a lot of the stressors quickly.
That's amazing. Yeah. And I can't wait to talk about each of those modalities individually. So you had been treating cancer for what, maybe like 15 years before you really came to specialize in treating Lyme and vector-borne disease.
Yeah,
So,
so cancer has been kind of my little specialty, just because my dad, he passed away from colon cancer, so it became very personal to me, and that's why I'm also with Dr. Talks. I'm hosting Breakthrough Cancer Summit, because I feel that that's another area where people are so frustrated. Their tools that are available in the medical profession is very limited,
yeah.
and what I saw quickly is that there is a direct correlation between factors that you need to address with both cancer and Lyme, because cancer in itself is essentially the same, where you have mitochondrial dysfunction, you have inflammatory responses, you have chemicals and heavy metals that are interfere with cellular function, making them turn them cancerous. And you have all these infectious agents that at the same time also promote cancer. So Lyme in itself as a infection is actually a big component for people then ending up with cancer. So the type of therapies go very much parallel, and the type of investigative work that needs to be done to look at root factors, and looking at the terrain of the body, looking at all these different factors, it's essentially the same. So that's why both of them, they really fascinates me. And the biggest thing, like yourself, is because the people in these two camps, both cancer and Lyme, they feel like they're lost. I mean, there's not much out there, and we need to really buckle down and find better solutions for them.
Are you ready to revolutionize your approach to diagnosing and healing complex chronic inflammatory illnesses in both adults and children? The Lyme Symposium is your gateway to cutting edge education, groundbreaking research, and innovative therapeutic solutions. Join us at Lyme Symposium at the Fort Lauderdale Marriott Pompano Beach Resort and Spa. Lyme Bites is the premier functional medicine conference on complex chronic infection-driven inflammatory illnesses. This year's meeting is jam-packed with leading industry experts discussing long COVID, mycotoxin illness, PANS pandas, as well as Lyme and other vector-borne diseases. This conference will arm you with the knowledge, clinical pearls, and practical solutions that you can implement immediately into your practice Monday morning that will literally change your patients' lives and get them on their path to true healing. So join us at Pompano Beach or virtually from anywhere. Register now at lymebites.com. That's LYMEBYTES.com. Yeah, I mean, in the Lyme world, if you can find a doctor that believes you actually have Lyme, oftentimes there isn't much more than pharmaceutical antibiotics, and steroids being offered, which is like, no. And then in the cancer world, it's like, what do we have? Chemotherapy, right? But like we forget about all of these lifestyle modalities and how food affects our body, right, for good or bad, and can promote inflammation and immune dysfunction, or help to resolve it. So it's funny because, your training and what you figured out for your cancer patients is almost like the exact roadmap that is necessary. Not maybe roadmap, but like same bases that you need to cover, the same sort of medical investigation that you need to do, in my opinion, with a Lyme patient to really have any chance at recovering their immune system and getting that infection into remission or out of the body, whichever the case may be.
And that's the thing, is that we when we think of cancer, then we think of the tumor. We got to get rid of tumor. We chemo, radiate, surgery, and all of that, forgetting that the tumor exists there for a reason. There's a
Right.
terrain that tumor grows within. And it's the same with infectious agents. We see, I got Babesia or I got Bartonella or Borrelia or whatever it may be. And then we go on high alert. I got to just kill
Right.
that infectious agent, not recognizing that that infectious agent, just like the cancer, exists within a terrain. And
And
that
if you don't
terrain,
fix the terrain, it's just going to come back.
exactly, exactly. It's like rats in the alley. If we can kill as many rats as we want, but if we don't clean it up, then they're just gonna keep on coming back.
So, all of these various treatment modalities that you've brought into your clinic and into your program, how do you balance them all?
So it becomes a journey, it becomes very personalized and individualized, because each person is in a different place and you have stronger drivers, for one individual versus another. So let's say one individual, maybe there's a traumatic event or very stressful event or belief system that really promoted the expression of Lyme in their body. So
Mhm.
then we need to then shift more towards making sure that we address those traumas, we address those belief systems, and we use things like APN, applied psychoneurobiology, EFT. We have theta chamber that we have that helps to kind of rewire the brain. So then we focus more in that area. Or let's say that the individual has, yes, they have Lyme, but they've also silver fillings. Maybe they've been a hairdresser, maybe they, auto mechanic, and we know that their toxic load is very heavy. So then we want to start to open up that those detox pathways, so that we can then kind of clean up the environment, so that when we choose to go after the pathogen, that the body can handle some of the die off and handle all, when have the energy to deal with as we're killing off the pathogen. Or it could be that a person's been dealing, they type A individual, they burnt up their adrenals and, thyroid was next, and that their testosterone is depleted or estrogen is depleted. So then we recognize we need to support endocrine system and start there. Each individual is very unique and they have a very unique journey on their getting well. And that's why it's so important then to have somebody to guide you through that process. And I do use different techniques. One of my favorite technique is the ART, or
Mhm.
autonomic response testing, that Dr. Klinghardt, they brought together a lot of different testing techniques, and this was to, mitigate a lot of the caveats. And that just helps me to see what priority do we need to address things in? What is the first thing first? And then so we can see what the body is ready for. And then we start to address that. And then as we start to address that, then we see how the body's responding. And then depending on how the body's responding, then we'll take care of that response. And that way we're guiding the person along a pathway that is congruent with what the body can handle and what it wants to do as a next step.
Okay, that makes sense. Now, how do you incorporate adjunctive therapies like ozone or photodynamic therapy, right? Is a big therapy that you do there in your clinic. How do you know when the right time is or the right sequence to do therapies like that? And how do you pair them with, I know you use a lot of botanical medicine, but sometimes conventional antibiotics and more of an integrative approach if it's warranted in that particular patient.
And I think I'm very much like you. I like to go botanical, way before, starting with different antibiotics, because I feel that these different pathogens, and they've been around for a long, long time. So, it's not like it's a new invention that all of a sudden we have Lyme.
Mhm.
So the plant kingdom, they've evolved, with these pathogens being around. So they've developed a, complex structure to be able to defend themselves, and then also to be able to exist with these different pathogens around them. So That's why I love bringing in herbals and plant medicine. And then so you can start there, and then you can see, depending on the individual and depending on what they've done so far, we can then choose to do a big push to kill things off. And we can use things like ozone, which is fantastic for people battling Lyme. And we have different versions of ozone. We can do something like it's called UBI, ultraviolet blood irradiation, which is a little smaller. I usually call it kind of a starter ozone type of
Mhm.
therapy. It doesn't have to be very powerful in itself, but then as the person evolves, we can then step into like major autohemotherapy, or EBOO, or RHP is another name for it, where we can essentially pull, ozonate like 4 liters of an individual's blood volume in a sitting. And ozone is quite fantastic. I mean, one, it helps to, it has that extra oxygen, so it oxidizes and pathogens, oxidizes, chemicals, heavy metals, and it really doesn't care whether it's Lyme, virus, fungus, bacteria, whatever it may be. It is fantastic at oxidizing whatever that may be. So it helps with the killing then of the pathogen, but then it does many other things as well. So it actually triggers a cascade of cytokines that helps to upregulate the immune system and make the immune system more effective in being able to deal with these pathogens. And then it also helps to increase the your mitochondria. So we know that a cell has X amount, of mitochondria within it. Mitochondria is the energy factor within the cell. And obviously, if we don't have energy within the cell, it can't regenerate, it can't detoxify, it can't do all the different things that it needs to do. And then we experience pain. And then because the cells are suffering, then they send out pain signals and inflammatory signals, etc. So ozone helped then to turn on the mitochondria and also help to rejuvenate, so that we can then have old mitochondria become like new again, and also helps to create these kind of big mega mitochondria to be even more efficient in producing energy. So ozone in itself, to me, that is such a fantastic tool when you are battling Lyme, because it fulfills so many different functions. Then we have things like vitamin C and artesunate are other 2 IVs that I love in combination with Lyme. Artesunate is really good at supporting also oxidation of pathogens and killing of pathogens. But at the end, it's fascinating because as an IV, when you do it intravenously, you have that initial, where it kills. But then after that, it has all these kind of immunoregulatory effects that last for weeks after.
Oh,
Where you
wow.
control inflammation, control autoimmune conditions, control, so many different functions of that. And then obviously, we have photodynamic that I bring onto the table. We'll talk a little bit more about that as well.
Are you suffering from Lyme disease or another complex chronic illness and aren't sure who to trust when it comes to herbal supplements? Hi, I'm Dr. Mariah Hinchy, founder of Lymecore Botanicals. As a naturopathic physician specializing in complex chronic infection driven illnesses like Lyme disease, I needed herbal medicine I could truly trust. That's why I formulated Lymecore Botanicals, where our herbal tinctures are handcrafted in small batches right here in Connecticut. We use the whole herb, never isolates, to preserve the full spectrum of medicinal compounds. Every single step from sourcing to extraction is done with precision to ensure maximum purity, potency, and consistency. These are the same herbal formulas I use to heal myself and have used for years to help my patients and family members heal too. And now I'm making them available to practitioners and patients everywhere. Lymecore Botanicals, herbal medicine you can trust from a doctor who lives this work. Learn more at Lymecore Botanicals. That's LYMECORE.com. Yeah, before you move on to photodynamic therapy for the listeners, so if someone were going through ozone therapy, like let's say EBOO, how often would one receive the treatment and how long would like the period of time that you would recommend the treatments take place to be effective?
It's a very powerful therapy. So when you do the therapy, the EBOO, the effect lasts for several days after. And usually I want to minimize the amount of other therapies that you do after because you almost kind of want it to run its course. There may
Right.
be some other things that I will bring alongside with it, but I want to minimize it. Um, Usually that you sit, so the treatment in itself is about an hour. And it's really fascinating when you look at the blood, coming out of an individual from the one arm. As just look this kind of dark, nasty blood, and then it gets filtered and ozonated, in the machine, and then it goes into your other arm, and here it's just vibrant and red and oxygenated, and it just looks beautiful. It's really fascinating. In fact, we did on one individual we did nutrition light blood cell analysis while the individual was receiving EBOO. So we took a little drop from their finger and put on the microscope, blow it up on a big screen, and then we can look at the red blood cells, white blood cells, and how they're all behaving. And you can also see pathogens. You can see fungus and spirochetes and things like that. And it was quite incredible to see while an individual's receiving the ozone, with the EBOO, the red blood cells was nice and round. They were separated, floating around very happily. All the immune cells are very active. They're very busy. And they were just, you can see how they were just working and kind of cleaning things up. Because usually when you look at the blood like that, you see at the red blood or the white blood cells, from an individual being infected. It's kind of like they are on vacation. They're laying by the pool. They're having a margarita. They're really not doing anything. They're just kind of existing,
Yeah.
almost like a governmental worker. Not just kidding. And then also you have, you see a lot of the red blood cells. They are all clumped together, and they're not able to really get into tissue because in the capillaries, which is kind of at the end of our blood vessels, which is where we get oxygen transported into the tissue. So that's kind of the last most important step. They need the red blood cells to be kind of a single file. And they
Mm.
need to be able to kind of fold themselves in order to be able to transport that oxygen into the tissue. And so when the red blood cells are clumped together like that we're seeing in the light blood cell analysis, then they can't transport oxygen. Yes, they can float around in the arteries fine, but to get oxygen to the tissue is not going to be very good. And so the tissue is going to suffer. Your nerves are going to suffer, because they don't get oxygen. So now you're going to be in pain. You're not going to kind of lose control in some fashion. So that was really fascinating with the EBOO. So I'm sorry I went off on a tangent. So
No, that's great. I doubt that most of our listeners have, have really heard that.
yeah. No, I love EBOO. So usually the quantity, the amount of times that you want to do that, I usually don't want to do it more than twice a week. I
Okay.
prefer maybe like once a week. But if we want to hit it heavy, then twice a week, and probably do that for 4 week time.
Okay.
That would be kind of the maximum, and then after that, depending on the individual, but usually then you kind of do an upkeep every 6 months or so, depending on what's going on. But that tends to be the pattern with that.
And if someone were already on, like, let's say, a lifestyle and botanical medicine regime, would they be able? I mean, obviously, the lifestyle you could probably continue, but when it comes to the botanical medicines or the herbs, do you recommend that they would stop that while going through ozone, or they could stay sort of on their standard protocol and then add the ozone in?
I still like them to have that net of
Yeah.
protection and support of the herbals, the botanicals. I'm very, it may be some adjustments, but very little that's needed. So I feel that if you are on the botanicals, you have done the lifestyle changes, and you've done all these prep work, then this becomes a really great next step, along with some of the other things we discussed.
Yeah, that's great. Okay, so tell us about photodynamic therapy now. What is that?
So photodynamic therapies is something that I love, and I use it both for for so many different things. So you have the component of what's called photobiomodulation, and then you have photodynamic therapy. So photobiomodulation, both of them uses light, photo being light. Photobiomodulation is restorative, regenerative, reparative. Photodynamic therapy is destructive, killing. And so you can use photobiomodulation just by itself. And that's using what we do is we have intravenous optic needles that we introduce. And that way we can treat the blood as it's passing by. And the beauty with that, it used to be therapies where you kind of circulate the blood through a machine and then it gets killed there with some light and then it goes back into the body again. Um, which is also very fantastic, but now you are taking blood outside of the body. So there's always the question of sterility and safety factors and things. And so here you're treating the blood essentially as it's passing by, and you are using an optic needle then to treat the blood. And with that, we have the ability to use different colors like ultraviolet, blue, green, yellow, red, infrared, and each one have different functions and they all impact the body in different ways. As since the blood passes by one point in the body about once every minute, so in a 60-minute treatment session using then intravenous laser therapy, you're actually treating the whole blood volume 60 times. So, which
In
is
one session.
in one session. And
Wow.
and consider that we talked about UBI or ultraviolet blood irradiation. What that usually looks like is that you pull 60 cc or 60 milliliters of blood, and you put that in a saline bag, and then you put ozone into that, and then you run that through a little machine that irradiates it with ultraviolet light, and then that goes into the body. So here you're essentially irradiating 60 cc of blood, versus 60 times of 5,000 cc's of blood. So
Wow.
you
That's
can
a
kind of
huge
see the difference
difference.
of impact. In
Right.
addition to that, then the blood is staying in the body, so it's in a sterile environment, and we can choose different laser colors. So depending, so we know the ultraviolet, it kills a lot. Blue kills a lot as well. Yellow then will work more on viruses. Fantastic going after viruses. Also the sunshine, color. So it makes you happy. It's an antidepressant. You have the green, a lot for the cardiovascular support, the red blood cells. Then you have the red really upregulates immune system activity. Same with the infrared. And we know that the mitochondria that we talked about, the mitochondria looks kind of like a train state, like several train stations. You have a train moving from one spot to another. And each spot, we kind of accelerate, how we produce energy. So these different train stations are called complex 1, 2, 3, 4. And we've seen that the different colors and impact the different complexes. So it kind of drives that whole energy production within the mitochondria. So that is the photobiomodulation that's really supportive, and that's when you just kind of run the colors by themselves. But then if you bring in the photodynamic, then we combine that with things like methylene blue. We combine it with a photosensitizer. So methylene blue would be a photosensitizer. You have riboflavin, which is just vitamin B2, is another photosensitizer. Even botanicals like curcumin, EGCG, and even vitamin C, they are all in some way photosensitizers. And what they do is that they will then attach themselves to the pathogen. And then, as the pathogen with that photosensitizer passes by in the bloodstream and the laser hits them, it intensifies the energy of that laser light that hits a pathogen and kills them. So it is a fantastic way of killing off a lot of pathogen, and then to layer that with things like EBOO, vitamin C, artisanate, it becomes really, really powerful therapy.
And so it sounds like the photodynamic therapy or the photobiomodulation is not invasive at all.
It is not. No, it
So
is very yeah.
where is it applied to the body?
So this is an applied intravenous. So wherever your blood goes, that's where it treats. So you can also we also have laser beds. We have HOCATs. We have other different devices that
Mhm.
helps to then hit a large amount of light, laser light onto the individual in combination then with the photosensitizer. So, and we also have laser helmets, for individuals that deal with a lot of neurological conditions. So then you can combine, let's say, methylene blue. You have them take that orally, or we do it intravenously if we want to have a higher quantity. And then we can have laser helmet on them in addition to do it intravenously. We can also do kind of laser up in the nose to kind of hit the brain that way. So there are a lot of different ways to utilize light and go after these different pathogens depending on where they're needed. And then yes, another tool, laser energetic detox is I don't know if you talked about that, but that's another
No.
kind of fascinating layer since we're talking about light.
Yeah. There's so many effects of light. So far, I think we've really only talked about far infrared. So
Okay,
yes,
yeah.
if you would like to speak a little bit more about that, please do.
Yeah, no. So yeah, each as I mentioned, yeah, the far infrared is great. It has if you only have a light source, far infrared will have the deeper penetration. But then if we use things that are intravenously, then obviously we don't need to just use far infrared, because we are then treating the blood directly. You can also use, these different laser watches that we have with the different colors. So you can then take a oral photosensitizer and then put on the laser watch, and we have the blood streams right here passing
Yep.
by. So as the bloodstream passing by with a laser watch, and we're essentially treating the blood. So that becomes a good home use type of therapy. Then something's called laser energetic detox. And that's something that was introduced by Dr. Klinghardt as well, is actually Dr. Lee Cowan
Mhm.
that really brought this to the world. And it's a fantastic tool to use on the homeopathic vials with substances like Borrelia, like mercury, like whatever it may be. And you can use that homeopathic vial and then shine a light through it, and what's amazing with that is that then that frequency of that homeopathic vial, that information will piggyback onto that laser beam or that light beam. And so as we are then shining it onto an individual, gives that individual the information about, that this is an issue like mercury or whatever pathogen is it may be. And so it is fantastic then at giving the body the tools that it needs in order to be able to eliminate, these different components. It's fascinating, when you do the laser energetic detox on, let's say, mercury, and the individual will start to pee out mercury, and they've been able to measure the chemicals or glyphosates, or like I mentioned, if it is a pathogen, it will give the immune system more information about that pathogen so that it can be more equipped to address it. And you can then use, what's called, where you go after different foci in the body. There may be, when you do the muscle testing, that you see that there's a large quantity of a pathogen like mold stored in the liver. And so now you can then use the vial, for that mold, and then shine a just essential there. You only need like a laser, like an LED, and shine that with the vial on top attached to it, and that helps to drive that pathogen or that chemical or heavy metal out of that location where things are stored. So light is amazing. It's incredible what it can do.
Yeah, it really is. That's fascinating. So let's switch gears a little bit and talk about some of the diagnostic tools that you like to use in your practice. So beyond, the testing and the specialty labs and all of that, talk to me about you use dark field microscopy, right? And then you use another test, RGCC. Tell our listeners a little bit about both of those and how you use them in your practice.
Yeah, so the light blood cell analysis or dark field microscopy, they're two different names of the same thing. I love because you can then see the blood directly to what's going on, and you can see impact of interventions that you're doing and seeing how the body responds to that. And you have with that, so you have the light blood cell analysis, dark field microscopy, and then you have what's called dry blood, where you actually see how the blood coagulates. And with that, you can see patterns, inflammatory patterns. You can see what's going on within the gut. You can see vitamin C rings, heavy metals, liver spots, parasites. I mean, there's so many things you can see just by looking at a few drops of an individual. So I love that aspect. Then obviously, we talked about ART or autonomic response testing. So that's another way for me to assess to see what's going on and how the nervous system is stressed by certain factors, being Borrelia or Bartonella, whatever it may be. And then you have others. So the RGCC, that is more in relationship to creating something that's called SOT, and that becomes a therapy in itself that you can use to target different pathogens, and that requires a little bit of a longer discussion, but that becomes a great tool for that. Then we have the different regular labs that we tend to run. But I also like to do frequency, where you check, the different frequencies of pathogens, and that can give you a huge amount of insight. So you have things like Monicore or AO scan, or there are a lot of different devices like that, and we have those different devices here, and that gives another angle of understanding. And I feel that there is no be all end all test out there. So it is good to have a few vantage points that you can use to be able to assess and monitor to see what's going on, because we know Lyme in itself, I mean, one of the things that it does is it goes after your immune system, your ability to produce antibodies. And how we monitor Lyme is with an antibody test. So we know then the challenge, to be able to be diagnosed with something that is, destroyed, so to say, by the disease. So it is good then to have additional tools to be able to monitor and assess and see what's going on.
Yeah, absolutely. And with a dark field microscopy, it's a way to actually have almost like a live view, like a now view, whereas antibodies can hang around for several months, depending on which antibody we're talking about. And so, yeah, it's not going to give you a real time insight, as to what's going on. And to your point, and we've talked about this multiple other times, there are Lyme affects the immune system and causes immune suppression, right? Or overreaction, or a combination of both, depending on the individual. And, it seems almost asinine that we're using a test to, detect something that destroys the immune system by analyzing the immune system, but there isn't a lot of other better ways. And so the dark field microscopy is an awesome tool, as are some other things. So,
Yeah,
all
yeah.
right.
Yeah, I agree. I mean, and it's not that the antibody tests do not bring value; they bring a lot of
Oh,
value.
for sure.
It's just a recognizing the limitations, and just because there's a negative test doesn't mean that it's negative.
No, definitely not. And I drone on and on about how, Lyme and other vector-borne diseases are a clinical diagnosis, right? And any testing that we're doing, we're kind of bringing in as a piece of that clinical diagnosis. It's not, a positive or negative test. So for any of our listeners who haven't heard us talk about that over and over again, and maybe you just caught this episode, such an important point. Such an important point. So, all right, talk to us about the role of rebuilding the immune system. We've talked about a little bit about testing. We've talked a little bit about adjunctive therapies and killing organisms and whatnot. Now, talk to me about your approach to rebuilding the immune system, which I think is one of the most important pieces of the puzzle.
And there's another similarity between Lyme disease and cancer is that you have patients going with chemo, radiation, surgery, And yes, the tumor is gone, and we do a little hip hip hooray dance. But you know these therapies are never going to be able to get rid of it all. There's always going to be some cancer there, and it's the same thing with Lyme. It's not like you're going to be able to get rid of all of the pathogens. There's always going to be some there. It's going to be some virus, going to be exposed to mold, going to deal with some parasites. They're going to have some spirochetes, running around. It's just the nature of life. We're going to be exposed to that. So now we need to have that buffer zone, that layer of protection, that to be able to address. We've reduced the load, we've supported the body, reduced the load of pathogens. And what do we have to protect us? It's our immune system. So that becomes key to do. And there are many tools, and we talked about some of the different things to go after the pathogen, and some of them also help to rebuild the immune system, like vitamin C, glutathione, it helps. Glutathione, we know that a cell cannot survive without glutathione. We produce energy with glutathione. If we are deficient in it, we're not able to have the appropriate antibody response. So there's so many needs for glutathione, and then vitamin C. Also, we talked about ozone that also help to support the immune system. But then things like mistletoe. We think a lot about mistletoe in relationship to cancer, but mistletoe in relationship to Lyme is fantastic. It helps to really reset the immune system, to upregulate the components of the immune system that needs to be, downregulate a lot of the inflammatory, extremely antiviral. So it is a fantastic tool to rebuild the immune system. And then peptides. I love peptides, thymosin alpha 1, thymosin beta, 4. Usually I use a kind of smaller version of thymosin beta 4 called TB 500. Um, we have, so there's so many wonderful tools, BPC, KPV, that are incredible in relationship to modulate the immune system and support, its function. And obviously, we got all the different mushrooms. We have beta glucans. We have astragalus. There's so many other tools as well. So immune system is so important. We can also bring in things like exosomes later on to help to modulate a lot of the inflammatory responses, and also help to kind of heal tissue and regenerate tissue. Because I look upon, when dealing with Lyme, it's kind of like you have a house on fire. You want to get rid of the fire. I mean, you can't really repair the house while it's fully on
Right.
fire. We gotta get rid of the fire, clean that up, and then we can repair. And so that, and a lot of times we think that we are still struggling with Lyme, when in reality it is post Lyme. It's that repair and regeneration that we haven't done, that we need to do. So it's recognizing the different phases and when to do what.
Right. So do you use a lot of oral peptides or IV or combination of both, depending on which peptide it is that you're wanting to work with?
I do both. Yeah. So you have with peptides, we do them both oral, we do them sub Q, and we also do them IV. IV, I like more, because you are able to obviously get it directly into the bloodstream. And I've seen tremendous changes in individuals quite quickly by doing that. For long distance guidance, and sub Q or oral becomes is a really powerful as well, like thymosin alpha 1. Like, for instance, when we had our COVID crisis, I used a huge amount of thymosin alpha 1, and I can't tell you how many people that I turned around by doing a heavier dose, doing a dose, twice a day, kind of hitting a little bit harder. And yeah, it's tremendous when you kind of lean on it a little bit harder. So, but IV, I think that is the optimum if we can. And I usually like to do combination of, thymosin alpha 1, TB 500, and maybe KPV or BPC, something like that.
So you have a vast amount of experience with all of this. Like that is evident. What would you say is the most important lesson that you've learned working with Lyme patients that you wish more people and people, medical practitioners, lay persons, whatever, what do you wish they would understand about the treatment of Lyme and other vector-borne diseases?
I think the biggest lesson, and I think this is kind of a common scenario for most people coming out of any kind of school, medical, naturopathic, whatever it may be. We are so gung ho and we want to fix it all and we get rid of it all immediately. And we want to hit the body with all these possible things. I think the biggest lesson is to really listen to the body, and sometimes less is more, and being able to navigate that journey without overdoing it, because I think sometimes when we are kind of newer in our profession, we're kind of like a child in a china store where we just start swinging and then things break. And so I think that is the biggest lesson that I've learned. And then obviously as I've evolved, I mean, I've been in clinical practice since 1987. So I've seen an evolution of a lot of therapies that were not available when I started that are available now. And to me, that the tools that we use, that we have access to now, is incredible. I mean, I think that just learning of their existence and learning how to utilize them and when to bring them in, to me, and having them available, it's so exciting to me, and the impact we can have on individuals with that.
Yeah, absolutely. So, are you taking patients in your clinic?
We are, yes, we
Okay.
are, and so we have a number of different providers, and I'm part of the process. And even though I may not be the immediate provider, I'm still part of the process. And yes, we do take patients, and yeah, if people are interested, just do a discovery call with one of our doctors, and then we're available to do that.
And how would our listeners reach you
So the
or your
best way,
staff?
yes, yes. So the best way, so you can find a huge amount of information on our website. It's at the Karlfeldt Center, and you can access in our Lyme podcasts that we have there. We also have a large number of free ebooks, and I believe we have offering a free ebook as well in how to address Lyme efficiently. And then you can always call us and if you want to learn just a little bit more, we're offering a free 15-minute discovery call, because I know a lot of people, they've gone to doctor, from one to another, and sometimes they just want to kind of get a feel of this next doctor, who they are and what they offer.
Yeah, that's great. That's a great service for people. I think it's so important to find someone that you feel comfortable with and you feel like you can be completely honest and also you feel like the doctor's got your back. Having that trust is so important. So you're starting a new podcast in addition to your Lyme podcast and your cancer podcast. What is your new podcast?
So yes, I love my Lyme. I love my cancer podcast, and I feel that they're so important to bring that information out to the world. I also love to discuss a little kind of deeper subject that may not be related directly to cancer line,
Mm.
talking about transformation, talking about maybe a little touchy subject, such as COVID and such as vaccines and such as things are spraying in the sky, and just kind of bringing deeper discussions about things that are intriguing to us and that are educational and enhance our understanding of who we are and our place in the universe, and bring in additional tools. Like I'll have Nobel Prize winners and physics and peace, peace, Nobel, people that ran for the Nobel Peace Prize. And so I'll have some amazing leading, thought leaders in the world on that podcast. So I'm
That's
I'm
great.
excited to bring that forth.
I'm excited to hear it. I think that's wonderful. And I think that it is very much needed, very much needed. And hopefully people are starting to wake up and to realize what's going on in our world and around us and what's actually making us sick. And I think having someone like you leading this discussion, lending credibility and the scientific backup, right, to all of this is so important. So I'm very much looking forward to that. What is
Okay.
the name of the podcast?
It's called Dr. K Show.
The Dr. K Show. All
Yeah.
right. So everyone be on the lookout for that. It was a pleasure. Thank you so much for being here with us tonight. I truly appreciate it.
It's always my pleasure. And yeah, you do such amazing work, and I'm so grateful for what you bring to the world, and whatever I can do to help, I'm excited.
Well, thank you so much. And right back at you. For all of you listening from home, thank you so much for joining us. I hope that this episode was helpful and brings you information needed on healing from Lyme. We'll see you next time. Bye bye.
If this episode gave you an answer, brought you new insight, or made you think differently, subscribe to the Lyme Bites podcast and share with someone who's ready to take control of their healing journey. And if you can, please leave a review. It helps others to find the show. Thanks for listening, and we'll see you next time.